Hello, 𝔸𝕬𝕠𝕦𝕥. I'm back again with another video. Now this video I'm going to show you all what I did, what kind of exercises I did to get rid of my back pain. So what happened was that because of my new job, I was driving more than 2 hours a day, more than 10 hours a week, and it was starting to have an effect on my back. I was starting to have back pain and I needed some therapy, or the therapist needed some therapy. And these are the exercises that I've been doing. And I also had to do some modification to my car to continue to decrease the pain, or to not even start the pain to begin with. So I'm going to show you 3 exercises that I did to get rid of the pain, and I'll also show you what I did to my car so that it can prevent that from happening again. So the first exercise that I'm going to show you, I'm going to lay down. Okay. And now lay down. I like my little pillow. Okay, you can definitely do these exercises at home, obviously. Okay, so the first exercise that I'm going to show you is I'm going to bend my knees. Okay, to bring my leg up a little bit. And because it was the right hip, I'm going to do the right one for you guys, but obviously you can do both sides. And I'm going to bring my knee with my fingers locked around my knee. I'm going to pull it towards my chest as far as I can go, and I'm going to hold this position. I'm going to count to 10. Okay. And then I'm going to let it go down slowly. You don't want to ever, whenever you're doing this exercise, you don't want to ever do this kind of bounce thing right here. You always want to have a firm grip and hold in that position until that 10 seconds. And then you want to let it go nice and slowly. And the same thing to this side. Pull towards your chest. You're going to feel the stretch along your back muscles and also your buttocks muscles. Okay, so you want to hold, count to 10, and then you also want to let it go. Another exercise that I did to get rid of my back pain is that I was doing the pelvic tilt. So I would tilt my pelvis towards my head and then down. So just look at my hip. You see my hip is going to kind of change. So I'm not doing the bridge. I'm just lifting my pelvis up. I'm holding. And then I'm bringing it back down. I'm going to lift it up again for a few seconds. And then break it back down. So this is really good for your pelvic muscles. Get those muscles to stretch themselves out, because I was really tight back there, and it's because I wasn't stretching. I wasn't, once I was in a static position for 2 hours a day, 10 hours a week, and I wasn't doing any kind of stretching, so my muscles were so tight. So you can do maybe 10 of these, hold for like 2-3 seconds, and then do another. So just tilting your pelvis down and up. Okay, and hold it. And now the next one that I'm going to show you, it's really simple. Basically what you're going to do is you're going to use one of your hand, bring it next to your knee, and you're going to roll your knee away to the left. You're going to hold this exercise, feel the stretch right in your buttocks, into your hips, into your back. Hold it for a few seconds. Come back to the starting position. Very nice and slow motions. You don't want to be doing a flip, okay? Very nice and slow and very controlled movement. You want to do the same thing to the other side. Feel the stretch. Hold for a few seconds. Make sure that you're also breathing. I'm doing a lot of talking, so I'm breathing. I always tell my patients to always breathe when they're exercising, and if you forget to breathe, just count what you're doing, okay? Because whenever you count, you're taking some oxygen in, and this really helps to get oxygen in and out of your body, feed those muscles that you're working, and also really good for your blood pressure. And because you're feeding those muscles, you'll be able to do a lot more of the exercise for a longer period of time. If anything hurt when you're doing these exercises, please stop and consult your physical or occupational therapist to help you. Okay? Now, I'm done with these exercises. I just had 3 exercises that I wanted to show you guys. Now, what I also did to my car is that because I was constantly doing this motion here, constantly doing this stop, and there's a lot of traffic in Maryland, and so I'm constantly doing this motion, constantly. I also irritated a lot of my muscles. My muscles were also inflamed back here. So if you can put your car in auto drive, and I forget the word for it, but if you can put your car in auto drive so your car can drive itself, that would be good. Another technique that I learned is to roll up a towel. I know people also say that a lumbar support also helps, but I literally got one of my towels from my house. I rolled it up just like this, and I put it right here when I'm driving. And this has been helping me a lot because it's kind of giving me a little bit of support back here when I'm driving. So these are some of the things that you can definitely do, especially if you drive a lot or if you stick in one static position a lot when you are at work and you're starting to feel some pains in your back. This is something that you can do in the comfort of your own home, in your own environment. And these are very simple, but I always tell patients, always seek a therapist's opinion and directions before you do any of these exercises. If you have any significant pain, I would say not to do it. Make sure you get an x-ray from a doctor, get a referral for therapy, and then we can give you a better exercise program to do at home at that time. Until next time, I hope you guys enjoyed this kind of demonstration videos. I'm going to try to do a lot more for you guys, and a lot of people have been requesting, so I thought that this would be a good one to do since this is exercise that I've been doing myself at home. Okay, if you cannot get on the floor to do it, if you have a pretty firm bed, you can also do these on your bed as well. Okay, until next time, thank you guys so much for watching, and I will see you in the next episode. I love you all so much. Bye. Take care of your backs, okay? Good body mechanics, even when you're driving.